incredibly valuable tool in evaluating hepatobiliary diseases in cats, a common and important condition in this species. The examination allows visualization of the liver, gallbladder, and bile duct, aiding in the diagnosis of various pathologies. When performing a liver ultrasound, the veterinarian should assess the size, shape, and echogenicity of the organ, looking for diffuse or focal changes. Liver size is a subjective assessment based on the operator's experience. An enlarged liver or hepatomegaly may have rounded lobes and blunt edges. In a lateral view, a large liver may more completely surround the right kidney. On the other hand, a small liver may make the gallbladder appear to occupy a large portion of the hepatic space. The echogenicity of the liver in cats requires special attention. Under normal conditions, the liver and renal cortex have similar echogenicities. However, in obese cats, the liver may show increased echogenicity due to fat accumulation, while in other cases, the kidneys may be more echogenic than the liver due to fat deposition in the renal tubules. Comparison with the spleen can also be helpful, as the spleen is normally hyperechoic relative to the liver. A useful tip is to compare the hepatic parenchyma with the falciform fat, as in normal cats, the liver is typically hypoechoic in relation to this fat. Ultrasound is also essential for evaluating the gallbladder. Normally, it has an oval or pear shape, with anechoic contents and thin walls, measuring less than 1 millimeter. Thickening of the gallbladder wall in cats is considered abnormal. Findings such as gallbladder wall edema, visualized as an onion skin appearance with hypoechoic layers between hyperechoic layers, may indicate acute cholecystitis or other non-biliary conditions such as right-sided congestive heart failure or hypoproteinemia, the presence of sludge in the gallbladder, echogenic material dependent on gravity is another important finding. Although common in dogs, sludge in cats should raise suspicion of hepatobiliary disease, especially if accompanied by elevated liver enzymes. Gallbladder abnormalities, such as wall thickening and/or sludge, increase the likelihood of positive bile cultures. Visualization of the bile duct is easier in cats than in dogs. In a sagittal section, the bile duct can be found ventrally to the portal vein. The normal diameter of the bile duct in cats is up to 4 millimeters, measured intraluminally. Ultrasonography allows the identification of dilations, thickenings, and obstructions of the bile duct, and the use of color Doppler is crucial in these cases to differentiate the bile duct from blood vessels. Cholangitis, inflammation of the bile ducts, is a common disease in cats. On ultrasound, cholangitis may manifest as thickening and irregularity of the gallbladder wall, presence of gallstones, cholelithiasis, and/or biliary obstruction. Dilation of the intrahepatic ducts, visualized as anechoic tubular structures in the hepatic parenchyma, is a reliable sign of complete biliary obstruction, although it takes about 5 days to develop. It is important to remember that the ultrasonographic changes in the liver can be subjective and that some liver diseases may not show visible changes on the examination. Therefore, the interpretation of ultrasound findings should always be combined with the animal's clinical signs, laboratory test results, and, if necessary, biopsies or aspirates. Liver sampling, guided by ultrasound, aids in the diagnosis of lipidosis, lymphoma, and other diseases. In summary, ultrasound is an indispensable tool in the evaluation of hepatobiliary diseases in cats, allowing detailed visualization of the liver, gallbladder, and bile ducts. Careful interpretation of the images, in conjunction with other clinical and laboratory data, is essential for an accurate diagnosis and an appropriate treatment plan.